I look at health disparities in two areas, access and healthcare, or different disease processes that you see in certain populations. As physical therapists, they need to be aware of that, because when they're making decisions, you can't use a generic approach to saying this is what that patient needs, because it may not work for that patient. And you have to consider the environment. And more recently, trying to talk to students about asking the patients about their home environment. I teach those courses, but I also bring them into a course that I teach on clinical decision making and talk about patient-centered care and shared decision making. And those two really allow you to really look at cultural competence and also look at address health disparities.
80% of the people that we see in our pro bono center have insurance. They can't afford to use it. And the issue is their copays are anywhere from $20 to $50. And they just can't afford to do it.
It's not going to happen in a year. This trust that we've established with the community, it's going to take several years for the community to trust that we're going to do the things we're going to do.
I have a lot of connections at Midwestern University, faculty in dental medicine, podiatry, occupational therapy. Let's just try to put together a wellness expo. And I ended up partnering with another organization in Phoenix that helps to service families that have needs, whether it's feeding needs or just lack of resources. And so we had a few different groups come together. I had dental medicine students show up. I had physical therapy students show up to perform health assessments. We had even, advocates for HIV interventions present. Mammogram truck present. We tried to really address all the different disparities that we might see in the community.
We as a School of Allied Health also wanted to provide some type of outreach to these individuals, and so we have health fairs that we have at our clinic annually. And so those are open to all people, and we provide education on exercise, nutrition, and we do screenings there.
The biggest thing that I would recommend to people is to be sensitive to the environment around them, that we really have to see the needs that are around us. Even walking to the convention center, say, we see a number of homeless people. We have to say, again, these are our brothers and sisters. We have to provide for them in some way. So being a physical therapist is a great thing, but to go around to have that full professional responsibility to say, how can I provide for them even outside of the normal healthcare structure?
For me to get in front of a group of 25 people and explain to them as much information as I can about how the body works, that when they go home, they have a better understanding of how their body is, and not to ignore their problems and to be aware of their problems. That to me was very powerful.
Next semester we have service projects that go actually out into the community. We do a couple of different ones in one of the classes, methods of instruction, for example. They go and they visit an urban Baptist church in which they can go in and actually interact with the members, also once again looking at the demographics, looking at the culture.
I would want to learn the key languages which are spoken by my client population, or learn the key cultural norms of the population that I'm treating. That way I can really empathize with them and get to the heart of what that patient needs. I feel like if it begins there, then the other things, the financial matters, which are largely out of my hands, can at least somewhat be accessible, because I know the only thing that I can really contribute is my relationship with the patient. And if that is the foundation, then hopefully teaming up with insurance companies or teaming up with the administration, hopefully they can bring forward the other disparities.